Okay, and our next speaker, as we've talked about now, this epidemic intersects a number of different areas. We've talked about public health, talked about law. Our next speaker comes to us in the area of law enforcement. Coming from the state capitol in Sacramento, please welcome Captain Helena Williams. She is the captain at the California Highway Patrol, as well as the head of the Impaired Driving Unit for the CHP. You're welcome.
Good morning. As you can see, I have a couple of different challenges. Number one being vertically challenged, so you're gonna have a hard time seeing me over all this. Number two, as a cop, I like to move. And being stationary here, I like being a moving target, not one that's just stationary. So forgive me if I kind of move around a little bit. I'm a 25-year veteran with the California Highway Patrol. And DUID, so driving while impaired, has been my passion since I came on the patrol. And now, fast forward to where we are now, it's such an epidemic because there's so many different substances that are available to our communities that make people feel good. So if they make you feel good, the chances for you to become addicted and to abuse that substance increases. Hence, with the passage of Prop 64, the legalization of cannabis in the state of California. What the Highway Patrol did was they actually created an impaired driving section solely dedicated to impaired driving, not only of alcohol, but all different drug categories. So extremely important that the Highway Patrol is now dedicated, not only a commander, but a whole entire staff dedicated to this problem. What are our biggest hurdles in these cases? Is community perceptions. Okay, officer training, how drugs metabolize, and accurate data. As I've heard just sitting in this room just for about an hour now, that seems to be the very common theme, is data. And in our arena, in law enforcement, there's lack of data to support some of the directions in which law enforcement wants to go. And the reason being is because of the statutory law, the way that the law is put together. So if you look at DUI, you have a variety of different sections of law that you can be charged with. Up until recently, the law was the A section. So if you're driving under the influence of alcohol and or a drug, and B, 0.08 blood alcohol content or above. So we haven't been able to capture really the problem of DUID because the A section puts it all together. It doesn't separate all the different drug categories. Okay, so that's extremely challenging for law enforcement. Officer training, there's 80,000 law enforcement professionals in the state of California. And I'll get to some training that we give to law enforcement, but when we look at the numbers, it's just a little bit less than 10%. And then how drugs metabolize. You all in this room are pretty well-versed in how drugs metabolize. When we even just talk about cannabis, metabolizes totally different than alcohol. Alcohol loves water, cannabis loves fat. So of course it's going to metabolize a lot different in the human body. How many of you have heard this? Okay, I drive better high. Not so, right? When we have incidents like this. And this person was 5 nanograms of cannabis, or delta-9 THC, and a little bit of alcohol. And look at the devastation. Okay, and these are people who are traveling among us on the highways. When we look at some numbers statistically, about 43% of people who have been tested, who have been involved in a fatal collision, had one or more drugs on board. So how many of you drove here today? Okay, you drive on the freeway. Usually we probably are driving in the number 2 lane, which is the middle lane, because we don't want to be in the fast lane because you don't want to see people like me, right? Okay, so you drive in the most safe lane. Well, think about it. You have someone in front of you, someone behind you, and left to right. You have a total of 4 people around your vehicle. Now look at 43%. You're bright. What does that mean to you? Does that scare you? Yes, absolutely scares me because I have family, I have friends, I have coworkers, members of my community that I serve, and they're traveling the same roadways with people who are possibly impaired. 43% is pretty high.
Gary Tugman talked with some addicts walking the streets. We want to warn you, this may be tough to watch, but we think it's important to see how the opioid epidemic is unfolding in the U.S. Here's Gary's report.
To most people, this is a neighborhood south of downtown Boston. To others, it's a living hell.
I'm a junkie. I've been shooting heroin for 16 years. I'm homeless. I live on the sidewalk. And this is my life.
You know, I didn't grow up thinking I was going to be a heroin addict. Like, this isn't exactly what I want to be. Like,
What are your hopes and dreams?
to get sober, to have a family. I, at one point, thought I was going to, and I lost the love of my life. We both overdosed, and when I woke up, he was dead.
Billy is 31 years old. He has a 5-year-old son. He wants to be a tattoo artist someday. But even while we talked, he was looking for a vein.
Is it possible for you to stop shooting the heroin while we talk?
If I had gotten it in me, it would be, but
But that's what I'm wondering, like you feel such a strong urge that you can't stop while we talk?
yeah. There's nothing that would stop me. And that's how bad it gets.
Megan also lives on the streets and the sidewalks.
You're about to reach your 30th birthday. And how long have you been addicted to heroin?
Since 19.
And how did you start the first time?
It was pills, then pills became expensive, hard to get, and heroin was just extremely easy to get and a lot cheaper.
Like Megan, the gateway to heroin for Billy was also pain pills. He was 13 years old when he started.
I was already using prescription pills. I liked the way it felt. I found out heroin was cheaper than the pills, and it was more intense, so I began sniffing heroin. And then I found out shooting it was the next step from there, and I would save money, and went right to shooting it. The first time I shot it, I fell in love with it. The only way I can explain it is like I met God.
Billy and Megan are joined in their opioid devotion with scores of other people who gather on the street that happens to be near a hospital, methadone clinics, and shelters. People who want to help. 40 miles up the road in the small city of Gloucester, Massachusetts, police will not arrest you if you come to the police station with opioids looking for help. The strategy of help, not handcuffs, started here and spread throughout the country. But after a much publicized and encouraging start, the police chief here is facing a stark reality. Things are not getting better.
We've seen an increase in fentanyl. Fentanyl is a drug that is 50 to 100 times stronger than heroin.
Like heroin, fentanyl is an opioid. Even a tiny dose of it can be lethal. Craig uses fentanyl. Like everyone we met on the street, he wants to stop, but says he can't.
I'm addicted to opiates.
So what do you do here in the street? What kind of opiates?
The thing is, all the opiates right now is fentanyl. So everybody's dying.
It's about to start pouring here in Boston. These people who can't live without their pills and their needles will be sleeping in dirt that will turn into mud.
Are you afraid you're going to die from this?
I know I'm gonna die from this.
Are you afraid you're going to die from this?
Not really afraid, and honestly, sometimes it just seems easier.
How does that make you feel? Okay? It's challenging just by listening to what they said. Started at a very young age. One was 13, one was 19. And what did they start with? Pills. Okay, and then just in this little small snippet of video, we saw the progression from addiction to abuse and where they're at now. So the reason why we're all here is we really need to look at a multifaceted approach to this problem. The demographics surrounding this crisis is vast, right? You have middle America, you have businessmen, women, academia, it's all across the board that are using and abusing opioids. And this is what we're faced with, Okay, there are different other drug categories that are used in combination with opioids as well. But when we look at Future here, okay, he has a song that he raps about Molly and Percocets. Okay, so it's in our mainstream culture. It's this acceptance of being able to use and abuse whatever substance that you want. And that's why we're here today, is now we're facing, if you will, we're reaping, what we just sowed. Okay, so until we can take a stand and say this is unacceptable and put resources in place to help with the crisis and the epidemic surrounding all drug use, we're going to keep seeing it being mainstream. Okay, this was in the Midwest. Law enforcement came across this vehicle, and there's a child in the back. Okay, this is my reality as a law enforcement professional. This is what I see. So when people get to this point, this is what I see. And the public safety hazard to me is exposure, not only to hypodermic needles, abscess, other diseases, but also the exposure emotionally. Who wants to deal with that, right? So when we look at a solve for this, we need to look at all the different people who are involved in the public safety sector and come up with real solutions that help everybody. Okay, just the numbers. I heard someone had a different number earlier. Okay, so over half of our opioid-related deaths had fentanyl. Okay, different drug categories. They use in combination. Outreach. Okay, we got to start somewhere, right? If we have 13 and 19-year-olds, where are we going to get the most impact? We got to go where they are. Community-based programs, how to teach, how to educate our youth on the abuse and use of these drugs. Okay, Highway Patrol officers, they are not only trained in the academy, but they had advanced training. By the time they are done with this training, they have over 156 hours of training in drug symptomology and alcohol abuse. We train prosecutors, our judicial professionals, a variety of different disciplines, health services. We're involved with court referral therapists. So we need to teach them about drug symptomology and how to recognize it and how to resource. Just the DRE training, the drug recognition evaluator training is 72 hours. Then they go into the field and they do hands-on practicals, similar to like clinicals. 32 hours of training, and they evaluate individuals who are actually under the influence of a variety of different drugs, including fentanyl and opiates and heroin and morphine. Okay, prosecution is all about training and outreach. We want to ensure that our prosecutors have relevant and important information so they can appropriately try their cases. Okay, I already talked about this earlier. We established an impaired driving section solely dedicated to this issue, and also the issuance of grants to research entities, nonprofits, law enforcement, and other government entities. And we are also working with the University of San Diego on their marijuana and driving study. Okay, current efforts, training officers. Okay, the ARIDE training, which is Advanced Roadside Intoxication Detection Enforcement, we've trained all Highway Patrol rank and file as of last year. And in the same course, we've trained about 7,000 other law enforcement officers. So that number that I had out there earlier, 80,000 law enforcement professionals, we've only barely scratched the surface. Emerging technology, oral fluid saliva testing, roadside. Highway Patrol right now, we're piloting a program looking at this device to give to the officers roadside to help them further detect the abuse of 6 different drug categories. Okay, we have a task force as well. These are all our stakeholders. As you can see, it is a multifaceted approach to DUID issues. Their goal is to establish best practices, look at technology, as well as introduce possibly new laws to further assist with this epidemic. Some more numbers, this is what we talked about earlier. 43% of drivers that were tested had one or more drugs within their system. Oregon and Colorado and Washington, they are seeing the same significant increase, and they're 3 years into the legalization of cannabis alone. Okay, in closing, this is my contact information. If you're interested in furthering training or you want me to bring training to you, I can do that as well. Okay, thank you for your time.